Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston. A big part of my surgical practice is breast procedures and specifically breast implant surgeries. I love that, I'm very lucky. When I first start talking to patients about their breast surgery, I just remind them that if they have implants, they're most likely going to need another procedure in their lifetime. Implants are not permanent things and they could rupture. And so at 12 to 15 years, it's ultimately recommended that patients get their implants exchanged so they start with a fresh set. So what is the cost of that? I think that's a pretty obvious rational question. Well, the cost for a surgical procedure is comprised of my fee, facility fee, and the cost of the implants. So for an even implant exchange, so with no other work being done, it can cost between $9,000 and $11,000 total. More likely that patient has gone through changes in their life, so age, weight gain, weight loss, pregnancy, maybe menopause, their body has changed. So if we're going to address those changes, which is often what I recommend, there's going to be more of a procedure and therefore more of a cost. So if there's a lift involved with the implant exchange, that can increase the cost. I may need to use soft tissue support to help support that implant and maintain the lift. And that is often with Galaflex. And Galaflex, just for the record, is not FDA approved for this procedure, but is a well-studied and well-used device. So in summary, the cost of a more extensive procedure can be anywhere between $18,000 and $20,000, again, involving my fee, the facility fee, and anesthesia fee. So I hope this is helpful. If it brings up any questions or concerns, please reach out. I'd love to chat. Thanks.